You can get started.
Welcome everybody to Spine Time. My name is Neil Mehta. I have been the host for the last few Spine Time sessions, so hopefully you have not gotten tired of seeing my face. Today I'm really excited. We're talking some really fascinating new cutting edge technology, and we're going to be speaking about the reality of back pain. And where does virtual reality help in treating pain? How does augmented reality help us in the operating room? And what does this mean to you? As you know, the Spine Center is located on 59th Street and 2nd Avenue, where is a multidisciplinary spine program ranging from spinal surgery, pain management, rehabilitation medicine, complementary medicine, neurology, and other techniques for helping you. And today, I'm joined by two very special friends. You all know Dr. Roger Hartle. He's the Hanson McDonald Professor of Neurological Surgery and one of the directors of the Spine program here at New York Presbyterian Hospital, and my friend and colleague for over a decade. And we have a new face, Dr. Rohan Jodwani, and he is our newest addition to our pain faculty here at Weill Cornell. We also are fortunate in that he was one of the residents here in the anesthesiology department before he left for fellowship at Brigham and Women's Hospital in Boston. We were able to recruit him back to bring all of his expertises here to the Cornell program. So welcome, gentlemen. Thanks for allowing me to host and be able to talk about virtual reality and augmented reality with you.
Thank you, Neil.
Thanks for having us.
Yeah, so Rohan, tell me, I mean, I see what Facebook is doing, which is apparently now called Meta. What is this? What is Meta? What is a metaverse? Give us, the high level discussion.
Yeah, sure. So, this is an area of academic and personal interest of mine, and there's literally no way to talk about virtual reality and augmented reality in 2022 without the concept of the metaverse coming up. And so from a definitional standpoint, I think it's important that we define what these different categories are. So the metaverse is something different than virtual reality, but everyone kind of associates the two together because of what companies like Facebook are doing. And the metaverse, in the easiest way to kind of encapsulate it, is a new way to think about the internet. So if you think about the internet when it first started in the 1970s and 1980s, it was really about researchers being able to share large documents with each other. And a network of computers, an internet, if you will, was created to help that. Web 2.0 is what we live in today. It's a social, interactive kind of internet where you can post content online, and most of us experience it through screens like our telephones or our computer screens. Web 3.0 is kind of what we're all in store for. And that's a world where the internet exists as part of our everyday space, whether it's a space that is created in front of us in terms of holograms, or whether it's a space that is overlaid amongst objects that we have all around us.
That's a very interesting way to describe it. So what is extended reality?
So this goes back to, people who really sort of work in this area trying to develop this new internet. Think of different ways to do that. And two ways to do that is through virtual or augmented reality. Virtual reality is, basically a immersion where you're wearing a headset and things are being projected in front of you. Augmented reality is a world where the simplest way to think about it is you're wearing glasses and you are in the physical world that you're in, but there may be holograms projected in front of you.
So Roger, I know this is an area of interest for you, the augmented reality. Tell me, what is it like? I mean, what sparked your interest in this?
Yeah, so what really got me interested in augmented reality is my interest or our interest in minimally invasive spinal surgery, because our goal is to get into the spine and treat things that are deep inside the spine with the least invasive access port, with a small incision. The problem is you can't see with your eyes, you can't really see what's inside the spine or in any kind of body part as a surgeon. So what augmented reality then for us really allows to do is that we're projecting the reality that we get from an MRI scan or from a CT scan onto our view of the spine. So we're looking at, for example, I have pictures later, we're operating on a herniated disc in the lumbar spine. Obviously in the operating, I can't see the herniated disc, I can only see the skin. But I bring in the microscope or have the goggles on, and I can project the exact location of that herniated disc into the microscope. So from the very beginning of the procedure, I know where I have to go. And that can be tremendously helpful because it makes it impossible to operate on the wrong side of the spine. It makes it impossible to operate on the wrong level. And from the very beginning of the procedure, I know exactly where I have to go. I make the skin incision at the perfect location, and everything else is really targeted and really tailored towards getting to that disc herniation and removing that disc herniation. So for me, augmented reality is something that makes surgery much safer and much more precise.
Interesting. Wow. So let's talk really briefly about how this evolved.
Yeah, so the great thing about having done a fellowship out in Boston is I got to spend some time at MIT. And the folks at MIT will tell you that this is nothing new. They have been working on virtual and augmented reality since the 1950s. The first basic flight simulator was created for pilots in 1966. And really the benefit of the reason we're talking about it today is because the devices have just gotten better. But it doesn't mean that we haven't been thinking about this for the last 30, 40, 50 years. It's just today it's become cheaper and more available thanks to companies who are trying to, investing a lot of money into it, where it's something that people, everyday people might be able to use. But we've been using this for a long, long time.
And I know both of you have been really kind to put together some great slides here, but questions come up in my mind and also from our audience that I'd love to make sure we have opportunities to ask. In talking about these projections and so forth that you talked about, Roger, in your prior picture, how accurate is that? And how does it help you in your diagnostic purposes as well? And if you need me to share a future slide, just let me know.
And Neil, for what I use it for, I mentioned a herniated disc or a tumor in the spine. It's highly accurate. It's like by the millimeter. And it is important, of course, because we're really basing our operation and the operative approach on exactly this disc herniation or the tumor. So it needs to be accurate. So for the purpose that I use augmented reality for, it's highly accurate.
And is there anything that's relevant in virtual reality, Rohan, like in terms of how accurate things are? I know simulation type things for education is one of your areas of interest.
Yeah, so I'm going to show it in a couple of slides. So,
yeah, let's get to it.
We can see actually in the next slide. So I was fortunate enough to be able to try on this headset, but this headset goes back to 1991. And this was one of the first headsets that was able to project what an operating room looked like. Now, Dr. Hartle's going to show us what he looks at today, but I want you to keep this image in mind because this is what it looked like 20 years ago.
That person kind of looks like Roger.
Thank you.
It was a huge, huge headset. And today, this is what it looks like. So this is me playing tennis in virtual reality at MIT. And the frame rate here is very slow because we're watching this on Zoom. But in real life, it's extremely fluid. When your hands move, the racket moves, the ball moves, the physics are just, they have spent many, many years basically taking the physics of everyday existence and being able to replicate it.
And
So
I see
golf
we
is
have
also
golf
another
here.
great place. Yeah. So this is me learning to play golf in virtual reality. So as you can see, my first shot totally spliced it. Somebody is watching me and then giving me feedback as to how I should fix my stance. And again, the frame rate here is a little slow, but in real life, this moves very smoothly, extremely smoothly.
So the question
So
is,
we can,
do you
yeah,
ever need to play real golf again if this is the equal experience?
that is a question that people are asking right now. I personally think that there's a really social element to golf. So it's not really, for me, it's not one or the other. But say you are living in a pandemic where making it to the golf course isn't possible, or you're recovering from surgery. Maybe this
Well,
allows you to capture a little bit of that again.
if they play less golf, they have less back problems for us to treat.
Yeah, we will be slowly out of business.
Right. Right.
Well, and I can see my sort of connection here with being a pain medicine physician. Talk about a little bit about what applications we're seeing here.
Yeah, I mean, so like I said, we've been doing this for many, many years. And so we've been looking at research at different areas. So virtual reality as a research entity, we've been looking at it in labor and delivery. We've been looking at it for young kids who are getting IVs placed prior to surgery, in palliative care, in acute postoperative pain. Probably the biggest area, though, is for burn victims. They've been using it a lot to kind of project images. So when burn victims come into the hospital, they need to get dressing changes very frequently. And those dressing changes can be extremely painful. And what they've been looking at is, this really interesting hypothesis done by folks out at the University of Washington. If we project the patient to be, say, in an igloo or somewhere in the Arctic, do they experience less pain during their burn dressing? And the answer seems to be yes. They've reproduced this study for many, many years. And so we know that it's more than just a projection. The projection may change the way that we think and feel about pain.
Yeah, I've seen the throwing snowballs at snowmen, and it was fascinating to me. So yeah. Talk a little bit about brain activity here that we're seeing.
Yeah, so this is from that same lab. This is from that same lab that looks at, the burn victims' dressing changes. And they did MRI studies on them as they were sort of, undergoing virtual reality pain therapy. And as you can see, the areas of the pain that were lighting up without the VR seem to diminish down when the VR is playing.
And certainly now has application in day-to-day life.
Absolutely. There are a lot of companies out there that are creating sort of programs. One very popular one is for work-related injuries. And since they've been doing these kind of programs, they've not only seen that over the course of, say, 12 weeks, pain relief gets better, but also other endpoints that we really care about, right? That, maybe people start coming off of opioid medications, or maybe they're sleeping better. And so there's a ton of research going into creating these kind of therapies for very specific use cases to help patients reduce their pain and improve their quality of life.
Hey, Rohan, can you give an example, like, for example, exactly what they do in a typical session?
Yeah, sure.
Did you have a clip on this here?
I don't think we have a clip on this in particular, but the study that I'm looking, the slide from this comes from a study that was done by a company called Harvard MedTech. And basically they have a headset that you can wear. It's virtual reality, and they have a 12-week program. You wear the headset 1 to 2 times a day. They have different simulations. So some of their simulations are based upon breathing treatments, learning how to take deep breaths and meditate. Some of them are rehabilitative. So because, like I showed you, you can play golf. You can also then try things like range of motion. So say you have a shoulder injury. They can, using the controllers, have you do a little bit more range of motion by playing a game. And then they also add to that phone-based behavioral therapy. So you do it all from home for 90 days. And they are able to get to you sort of through the device and through the behavioral therapy, a complete package that includes understanding where pain comes from, understanding how to escape from pain, meditation techniques, distraction, but also a little bit of rehabilitation.
Fascinating. So I know that we now have a actual device that can be used in day-to-day treatment. Let's talk a little bit about how accessible is that and what does this cost if you have that kind of information?
Yeah, so the cost varies based on the company that you look at, but there was a company, Applied VR, that actually recently got FDA authorization. So they went through the process just like you would if you had a drug. And the FDA reviewed the data and said, this looks like it's beneficial. And so within the next year, actually, there are codes coming out from the AMA that may get this covered by insurance. And that's the ultimate goal, is to see, if we really can see the benefit, if this keeps people, gets people off of medications, if this gets people back to their lives, the hope is that insurances will cover this. And then for workman's comp, that's been another area where it seems that there is some coverage for that.
So if I can challenge you, when do you think this would be available at our spine center? And it looks like Phyllis beat me to the punch to ask that very question.
Well, right now, the therapy is available. It could be out of pocket, but I could offer this to patients tomorrow.
And what would that cost, just roughly?
The number depends, again, based on the company that you go for. Applied VR may be, usually right now it's between the hundreds to low thousands.
Got it.
How would you get the goggles? I assume you need
They would
goggles,
send it to
right?
you. They would ship it to you.
That's the cost. And it would tie in with your phone, or it'd be a standalone unit, or?
Yeah, so it's most of these are standalone units. The cheapest option actually is to just buy one of these. So this is the Oculus. This is the headset that I keep in my office at all times. This is available from Facebook for I believe it's around $300 to $400. And if you buy it, just like with an app store, you can buy meditation apps, you can buy fitness apps, you can sort of buy the whole thing. You don't get the program. So it's these companies that are developing these unique programs that are showing a lot of evidence to work. But if, say, you just wanted to check it out, it's readily available for most folks.
Wow. So for our audience, you can see that we're all sort of learning together here. And it sounds like we have some work to do to get this available very, very soon. So obviously, I brought Dr. Jodwani Rohan here to talk about it because this is his interest. And so walk me through what we're seeing here.
Yeah, so one of my particular areas of interest is training. So here you can see that we've using models from a company called 3D Organon. We're able to create these complex models and teach our residents and our fellows how to do procedures like we would, and they can practice many, many times over and over and show us what they can do before it ever touches a patient. And so the idea being that this would be something that could potentially improve safety and outcomes, and also improve training for the next generation of physicians.
I mean, certainly, and I can see that. How would you take this type of technology, and how do you train your surgeon residents, Roger?
It's very similar. We just published a paper, and we actually won an award for that. We published a paper where we used surgical simulation, which is very similar. We used surgical simulation to train residents and fellows to do the same procedure 3 times in a row in a surgical simulation setting. And we videotaped their performance. We measured the number of mistakes they made, the smoothness of the operation. And it showed clearly that, obviously, as you would expect, but people haven't really shown that yet, the more frequently you do the operation in a controlled setting with teaching and training, the less mistakes residents make and the more skillful they become. And it only takes three, in that particular scenario, it only takes 3 repetitions. So you can only imagine if you do it 5 or 10 times how good they're going to be. And so it's exactly the same thing. It's slightly different technology, but surgical simulation is something that's becoming more and more important for what we do as surgeons. And now that we're gathering the evidence that actually shows and proves that it's very helpful.
Yeah, amazing. I mean, we use simulators, but I hate to call it that word because really they're just models. And this is so far advanced. But just use of practice models has made our physicians so much better, faster.
Yeah.
Do you find that there are any limitations in just how relevant this is, how human tissue feels, or how your hand moves in real life versus the simulated setting? And that question is to either one of you.
So haptic feedback is something that these companies are really working on. So for example, 3D Organon, a company I work very closely with, is coming out with an ultrasound simulator. And they're trying to take the experience of putting an ultrasound on a human body and making it something so that you could just do it in a free form way. But as anyone who really knows and uses an ultrasound knows, there's haptic feedback. How much pressure do you put? There are little things that we can do right now. We can create buzzing in the remote controls. But the next generation of tools will be, basically wearing gloves or a haptic feedback suit that's going to be able to tell you more information about what's going on. So all of that technology is being worked on right now. And I look forward to seeing how real we can make these simulations without, hopefully we don't end up living in a matrix, but these companies are getting close.
That's fascinating. Roger, I
Yes.
see you're wearing something really unique here. Walk me through this. What are you wearing?
Yeah, so this is a set of glasses that we used for a while for enhanced or for augmented reality. So the big difference between what Rohan talked about and what we use it for is that for virtual reality, which is great for teaching and training, you kind of immerse yourself into an artificial environment and you can't really see anything. Everything is projected into your glasses and you move in that space. When we do surgery, obviously, we need to see what's going on. So we can see the anatomy, we can see the body, but then things are being projected into those glasses that we want to see that we can't see usually. And that's what these glasses do. So you put the glasses on, you can see the anatomy, you can see exactly what you're doing as a surgeon, but then you can project in certain parts of the anatomy that you would like to see. And you know where that anatomy is because you have a navigation system there. You can pull it in from an MRI scan or from a CT scan. Now, when I wear these glasses, though, as you can imagine, you don't get a lot of magnification. So some of the complicated operations that really require magnification and illumination because they're microsurgical, they're very difficult to do just with those glasses. So we realized that as a limitation of these glasses for the types of surgeries that we typically do in neurosurgery. And that's why we then started using the microscope. And I think that's probably the next slide, because the microscope is really a device, or this is an example of, there's a paper that's just coming out now, actually in a few weeks that we really pioneered. That's the use of augmented reality for the treatment of spinal tumors. So on this slide, you see on an MRI scan, you see in the center that round structure in the spinal canal that we marked. So that is the tumor that's inside the spinal canal that we want to take out. We want to plug it out of the spine. And how do we get there without making a huge incision and removing a lot of bone? Well, we mark it on the MRI scan. And then if you go to the next slide, we mark it on that, and that's a CT scan showing the same tumor in brown. So we color code it, we mark it, and then the next slide, I think, will we'll see the microscope. And then instead of wearing glasses, because with glasses, we wouldn't really be able to get the magnification that we need to really do this operation safely. Instead of the glasses, we bring in the operating microscope. And then by looking through the microscope, you can project the location of the tumor into your visual field. And that's the big difference between virtual reality and augmented reality. So here we're actually looking at the real world, but we're enhancing the reality, or we're enhancing it by inserting and introducing pictures of structures that we're interested in. If you go to the next slide, I think you need another picture of a microscope here, and then the next slide. And that's what it looks like, for example. On the left side, that's the patient's skin. And we see in blue, this is the projection through the microscope. I can look through the skin. I know exactly where the tumor is. And I make the skin incision right next to it on the right side. And then I put a little tube in, I dilate, and I find that tumor much more precise than I would if I didn't have this information. So that's how we use then the microscope, for augmented reality rather than the goggles.
Understood.
And then how is the projection made? Yeah, we know where the tumor is on the preoperative MRI scan, and then in the operating room we get X-rays or we get a real-time imaging study, and then we merge, and that's a process that is being automated now. We merge electronically the preoperative MRI scan where we mark the tumor with the intraoperative CT scan. The computer merges it, and then we can look at both, at the MRI scan and the CT scan through our goggles or through the microscope. If you click on this video here, this is a typical example. This is a minimally invasive spine case. You can see on the screen here, we're operating through the microscope, and you can see the surgeons handling the instruments through the little tube that we put into the spine. And now we already placed the screws, and the augmented reality shows us here where those screws are. You can't even see the screws because they're under the skin already. And then this is one of my colleagues through the microscope. That little instrument there helps us to calibrate the microscope. He's doing the surgery to the skin, and then everybody in the operating room sees exactly what's going on that screen, and you can dial in and out the tumor or the screws, whatever you want to see that you wouldn't be able to see with the naked eyes. So a lot of technology, a lot of really exciting stuff.
Yeah, and I guess the next follow-up question is, one, where does this start to get towards robotic surgery? And then another related question is the recovery time change when compared to sort of pre-AR usage?
Yeah, that's very interesting. I mean, robotic, surgeons always talk about robotic surgery for spine, and it's a big marketing thing. And it is potentially very, very important and very exciting. Right now, robotic surgery for spine surgery means essentially that you have a predefined trajectory to put in screws, and the robot brings you to that trajectory. What I would like to see, and what we're working on, is something that I saw a week ago. I did a case with Dr. Port, Jeff Port, who is one of the thoracic surgeons here, who's really a pioneer of robotic surgery in the chest. So there's a big spine tumor attached to the spine in the cavity of the chest, and he made small incisions with a robot, went in there, and basically was sitting in the operating room, operating on the screen while the robot was actually doing the surgery, but he was obviously completely controlling all the instruments that the robot was using with his own hands. You can do that in the chest right now. In the spine, it's very difficult because the instruments are not small enough that we have available. So we're working on miniaturizing the instruments, so eventually we can use those instruments that he uses in the chest, maybe one day in the spine, maybe even in the brain. That would be real robotic surgery. Right now, what we're doing in spine surgery with robotic surgery is mainly retracing the trajectory for screws when we put screws into the spine.
Wow. I mean, truly amazing.
Yeah.
And I know this is the video we just saw. So this is clearly, you know, a growth in the theme of your life's work, Roger, which is, you know, minimally invasive spine surgery. And it's almost funny to see computer-based techniques being published in a printed book. So,
Well, and you know, believe it, the publisher actually said that's probably the last book that they published
yeah,
because everything is going to be online, or you can buy books as needed. What's going to happen is you just, if you want a printed book, you have to, you know, they print it for you custom.
yeah,
But this is indeed a book that kind of summarizes everything that's going on in minimally invasive spine surgery. And I know that even the non-operative things that we covered, you know, I think you were one of the co-authors, and Ricky. So we talk about non-operative spine care and minimally invasive spinal surgery, but also about navigation, robotic surgery, augmented reality. That's all in this book. It's probably not that interesting for our audience here today, but it is I think it's an amazing summary of what's being done currently and where we're heading in spine surgery.
I certainly believe and agree with that. I mean, it was an amazing thing to be a part of, and I was just one aspect of it, but it truly reflects all the work you've done in this space. To Phyllis, who asked, can we see this program again? Well, you know, I think we're getting to the end, but that's exactly what the last slide always talks about, which is you can watch this episode or any of our prior episodes at Spine Time on YouTube through the YouTube program at youtube.com/Brain Spine Center. And of course, we always welcome you to come have a visit with us, you know, seek out medical care any way that we can help you, whether it's with Dr. Hartle, Dr. Jodwani, myself. And in 2 weeks, we will be back again, Dr. Hartle, myself, Dr. Singh, to talk about the research that is going on. So a really great segue of you know, what's new and exciting in the Spine Center to what's new and exciting in terms of research ongoing at the Spine Center at this very moment. So again, thank you very much for joining us. Thank you to my co-host, Dr. Hartle, Dr. Jodwani, and look forward to seeing you all again in 2 weeks.
Thank you, Neil. Thanks, Roland. That was great.